Allergies cause a tremendous problem in the United States. 30% of the population is allergic. It used to be 20%, now it's 30%. People become allergic to pollen in the spring. It'd be tree pollen, which is March, April, May. Grass pollen, April, May, June. Ragweed and weed pollen, middle of August until the first hard frost. House dust allergy that's due to a little dust mite. Mold spores, little organisms that form spores that pop off in the air and float around. In fact, there's always mold in the air except when there's snow on the ground. And then we have foods that can cause allergy. And last but not least is dogs and cats. Once you get cat dander in a room, it takes 4 months to get it out. Once you get dog dander in a room, it takes 2 months to get it out. When people breathe in the things to which they're allergic, normally the immune system would take care of it. It would develop a blocking antibody. But for some reason, usually a familial predisposition, that means it runs in families, allergies do, instead of developing a protection to a pollen, a dust, a mold, an animal dander, or food, people develop an allergy antibody. That can hook up to the nose, or it can hook up to the lungs. And from then on, anytime you breathe in that thing you're allergic to, it's going to cause an allergic reaction. Releases a substance we call histamine that causes itching and sneezing and runny nose, makes people miserable. But 90 minutes later, there begins to be a recruitment of cells into the nose that cause congestion and blocked head and fullness and can't breathe. That's usually the symptoms that bother the people most who have allergy, is that nasal congestion. Lots of things that we can do for that. Avoidance, we'll talk about that in another tape, especially dust avoidance. There are medications that we use. We now like topical antihistamines. We have sprays now that we can put antihistamines on the nose that work 3 or 4 different ways. Work both as an antihistamine, but work against the congestion also. These nasal sprays are not steroids. They're antihistamine sprays, and they don't have a rebound. You don't get hooked on them like some of the sprays over the counter, Afrin, Walgreens 12-hour. Those are oxymetazoline, and those are sprays that we don't like. The other spray that we use for treatment is a cortisone spray. We now have cortisone sprays that are not absorbed and cause no side effects. They take 2 or 3 days to work, but they work very, very effectively for congestion, which is that big thing that's bothering patients with the allergic reaction. So we've got avoidance, we've got medications, and most of all, we've got immunotherapy that can help the patients. These are allergy desensitizing injections. 4 reasons to take allergy shots. It's the only way to get rid of the allergy. It's the only way to get rid of constitutional symptoms of fatigue and malaise that are due to the allergic reaction. It cuts down the incidence of asthma, or if you have asthma, it can make your asthma better. And it keeps you from developing new allergies. So if you want to get rid of your allergies, and I hope that's why you came to our office, allergy desensitizing injection will be the best treatment for you. If not, we can try avoidance and we can try medicines. We're here to help you and to do what's best for you.